everyone, and welcome to Beyond Care, where we explore the issues, decisions, and stories that shape the caregiving journey. I'm your host, Annika Dhariwal, co-founder of Learn to Care. Today, we're diving into a topic that touches millions of families: how Medicaid and Medicare work when it comes to home health care. It's a subject that can feel like a maze, but understanding it can mean the difference between getting the care your loved one needs and missing out on essential support. Joining me is Michaud, Jr., a licensed healthcare professional and veteran with more than 20 years of experience in managed care. Guy specializes in Medicaid provider relations and strategies for managing the costs of extended care. Plus, he has a wealth of insight into navigating the systems that so many of us find overwhelming. Guy, welcome to Beyond Care.
Thank you for having me.
I'd like to start by asking, for someone that is new to the caregiving role, what are the key differences between Medicaid and Medicare when it comes to paying for care at home?
Wow, that list can be kind of extensive, but just to narrow it down. So Medicare has two parts, Part A and Part B, right, which typically covers things like skilled care, nursing home therapy, some limited personal care you may have, while Medicaid basically just focuses on long-term custodial care, which they call it.
And then what would you say are some common mistakes or misunderstandings you see when people first try to qualify for Medicaid to support home health care?
Well, one of the main things is that, I specialize for the state of Florida.
Okay.
There's a lot of things that you can use to apply for Medicaid in the state of Florida, where most people would never even fathom that they can qualify for.
Right.
So, for example, just say that they set a base limit of your income being a certain amount, right? Although they set that limit to qualify, even though it's above that limit, there's certain things that you can do to still qualify for Medicaid.
Okay, and then just to confirm, this is something that varies state by state, right?
Yes, it does.
Okay. And then when someone's loved one is receiving home health care through Medicaid or Medicare, what are the most important questions they should be asking their provider or care agency to make sure they're getting the full benefit?
Well, it should be just to make sure that whatever the order was written by whatever provider, that agency who's going to be providing the services has that same order, that they're going to provide those same services that were requested by the provider, right? And basically, what that specifies is that how often will the nurse come out, or will the nurse come out, or will it be a home health aide that comes out, right? And then, after the plan starts, who will be the one that's going to coordinate the care plan once the plan has started? And then, most often, one of the main things that they forget to realize is that once the plan of care starts, that it still has to be reviewed ongoing to keep the services going.
And what are some simple steps that caregivers can take now to prepare financially for kind of future home health care needs, whether through Medicaid, Medicare, or private options?
You said, so what are the steps of the caregivers or the home health agencies?
Mostly like caregivers, but home health agencies as well, kind of whoever it applies to more.
Okay, well, mainly probably the background check. They've been certified and trained on the services that they're going to be providing, in the individual's home.
Okay. And when should a caregiver reach out to a Medicaid or Medicare specialist like you, and what can they expect from that kind of consultation?
The caregiver, well, whenever the need arises, say for example, where they know that whoever that they're caring for is going to need some type of level of services when it comes to that, it's best to reach out so you can get a full understanding, because the process can be overwhelming. And then the more you know, the more informed you are, the better you are, when you start that process. Because like I said, when you're dealing with loved one and you're in that particular situation where now home health is needed and care is needed in a home for that individual, it can be very taxing on someone.
Understood. That makes a lot of sense and makes it a lot clearer, I think, for our listeners. Guy, thank you so much for making this topic clearer. Understanding Medicaid and Medicare can truly empower families to make the right choices for their loved ones. For our listeners, if today's conversation helped clear up some of the mystery around home healthcare coverage, share it with another caregiver or home care agency who might need it. And remember, getting the right information early can save time, money, and stress down the line. Until next time, take care of yourselves, everyone, and each other, and thank you for listening to Beyond Care.